Hi, and welcome to a lecture on asthma in adults. Asthma is a chronic inflammatory disorder of the airways. It involves complex interactions between many cells and inflammatory mediators. These complex interactions result in inflammation, obstruction, increased airway responsiveness, and asthma symptoms such as wheezing, coughing, chest tightness, and shortness of breath. Classification of asthma. Asthma severity classification according to the National Heart, Lung and Blood Institute include 4 categories: intermittent asthma, mild persistent asthma, moderate persistent asthma, and severe persistent asthma. Bronchodilators, the short-acting inhaled beta-2 agonist. Salbutamol and terbutaline are selective beta-2 agonists and are agents of first choice for the treatment of acute exacerbations and for the prevention of exercise-induced asthma. These agents are best used as required rather than on a fixed schedule. Note here that although potent bronchodilators, these agents have very little effect on the late phase or inflammatory phase of an exacerbation. Anticholinergics are not routinely indicated in asthma but may have a role in certain circumstances. Ipratropium is a useful alternative for patients who are unusually susceptible to tremor or tachycardia from the use of beta-2 agonists. Theophylline products such as oral theophylline and oxyphylline are uncommonly used due to systemic toxicity and only mild bronchodilator activity. Aminophylline is no longer available in an oral formulation. Systemic corticosteroids are useful in both preventing and treating acute exacerbations. Optimal dosage has not been established. Side effects are significant and include fluid retention, glucose intolerance, hypertension, increased appetite, mood alterations, and weight gain. Immunoglobulin E neutralizing antibody. Omalizumab, a monoclonal antibody that binds immunoglobulin E, may be considered for patients with moderate to severe persistent asthma in those who have had a positive skin test or in vitro reactivity to a perennial aeroallergen and whose symptoms are inadequately controlled with high-dose inhaled corticosteroids and add-on therapy.